Today, we're going to talk about the 10 biggest mistakes seniors make before blood tests, mistakes that can completely change your results, confuse your doctor, and even lead to unnecessary treatments or medication. And make sure you stick around till the end, because mistake number 10 is one that almost every senior makes without realizing it. Let's get started. Mistake number 1, eating before a fasting test. This one might sound obvious, but you'd be surprised how many people forget what fasting really means. When your doctor tells you to fast before a blood test, they usually mean no food, no drinks, except water, and no coffee or tea for 8 to 12 hours before the test. Even a small snack, like a banana, a few nuts, or milk in your coffee, can alter your glucose and cholesterol levels. And for seniors, especially those monitoring diabetes or heart health, that small change can completely mislead your doctor. So, before your test, make sure you ask exactly how long you should fast and what's allowed. And if you take medications, always confirm with your doctor whether you should take them during fasting or not. Mistake number 2, drinking coffee or tea in the morning. Many seniors wake up and head straight for their morning cup of tea or coffee. It's a ritual. But if you have a fasting blood test, that cup of coffee can ruin your results. Coffee, even without sugar, can stimulate your metabolism and affect hormones like cortisol and insulin. This can alter glucose levels, liver enzymes, and lipid readings, making your test results less accurate. The same goes for tea, especially if you add milk or sugar. So, before a blood test, stick to plain water only. Once the test is done, you can reward yourself with that cup of coffee. Mistake number 3, taking supplements or vitamins before the test. Vitamins, supplements, and herbal pills might seem harmless, but many of them can interfere with your blood results. For example, biotin, vitamin B7, which is common in hair, skin, and nail supplements, can cause false results in thyroid, hormone, and cardiac tests. Similarly, iron supplements can temporarily raise iron levels in your blood, giving your doctor the wrong impression. If you're scheduled for a blood test, it's usually best to stop supplements 24 to 48 hours before, unless your doctor says otherwise. Always bring a list of your supplements to your appointment so the lab knows what could affect your readings. Mistake number 4, not drinking enough water. Dehydration is one of the most common, yet least talked about, issues in senior health testing. When you're dehydrated, your blood becomes more concentrated. This can lead to false high readings of cholesterol, red blood cells, and certain electrolytes. Plus, if your veins are harder to find, it can make the blood draw more difficult and painful. So, the day before and the morning of your test, make sure you drink enough water. Clear, plain water helps your veins plump up and ensures your sample gives the most accurate results. Mistake number 5, overexercising before the test. Exercise is great for your health, but not right before a blood test. If you go for a morning jog, do yoga, or even take a brisk walk just before your test, your body releases enzymes and hormones like creatine kinase and cortisol. These can temporarily raise your glucose, cholesterol, and liver enzyme levels. So your doctor might think there's a problem when, in fact, you just worked out too soon before your test. It's best to avoid strenuous activity for at least 24 hours before a blood test. Relax, rest, and let your body settle into its natural state. Mistake number 6, forgetting to tell the lab about your medications. This one is critical, especially for seniors who take multiple prescriptions daily. Many common medications, like statins, diuretics, blood pressure pills, and even painkillers, can affect blood chemistry. For instance, cholesterol-lowering drugs can alter liver enzyme readings. Pain medications like ibuprofen can affect kidney function tests. Always carry a list of your medications and give it to the technician or nurse at the lab. That way, your doctor can interpret your results correctly, knowing what you're taking. Mistake number 7, stressing too much before the test. You might not realize it, but stress has a real effect on your blood. When you're nervous, anxious, or even rushing to the clinic, your body releases cortisol and adrenaline. These hormones can increase your blood sugar, raise your blood pressure, and alter several test results. For seniors, This can lead to false positives for diabetes, heart problems, or adrenal imbalances. Try to relax before your test. Take deep breaths, arrive early, and avoid stressful situations. Remember, calm mind, accurate results. Mistake number 8, drinking alcohol or smoking before the test. A glass of wine at dinner or a cigarette in the morning might not seem like a big deal, but both can mess with your test results. Alcohol can increase triglyceride levels and affect liver function tests for up to 24 hours. Smoking raises adrenaline, affects glucose levels, and reduces oxygen in your blood. Doctors usually recommend avoiding alcohol and smoking for at least 24 hours before your test. Doing this ensures that your liver, kidneys, and metabolism give a true picture of your health. Mistake number 9, ignoring the time of day. Did you know that the time you take your test can influence your results? Certain hormones and substances in your blood, like cortisol, testosterone, and iron, naturally fluctuate throughout the day. That's why most doctors recommend getting your blood drawn early in the morning, between 7 and 10 a.m. This timing helps standardize the results and ensures accuracy. If you do your tests at different times each visit, your readings might vary, not because your health changed, but because your body's natural rhythm did. Mistake number 10, not following up or misunderstanding results. This is perhaps the most serious mistake of all. Many seniors take their blood test, get the report, and either panic because something looks off, or ignore it completely because they feel fine. But here's the truth, lab results are not diagnoses. They are tools that doctors use to look at trends and patterns over time. If your cholesterol or blood sugar is slightly high once, it doesn't mean you're sick, but it does mean your doctor needs to see the full picture. Always schedule a follow-up appointment to go over your results with your doctor. Ask questions like,